On the morning of November 7th, 1965, my mother walked into her son's room to check on him because apparently he had decided to sleep late. What she found on that morning when she walked into his room is something she would never forget. Her precious baby boy, only 7 weeks and 3 days old, lay blue and lifeless in his crib. William Daniel Luck Jr. died of SIDS, sudden infant death syndrome, also known as crib death. On Thursday, April 2nd, 1992, my son, Justin, suffered numerous apnea episodes and was admitted to Vanderbilt University Hospital for 6 days with a respiratory virus called respiratory syncytial virus, which progressed into pneumonia. True apnea, like we experienced with Justin, is the absence of respiration with significantly decreased heart rate. Because Justin was premature and he had numerous risk factors, he was placed on a heart and apnea monitor shortly after birth. If the equipment had not alerted us of his respiratory distress that day, he may well have died of crib death. In some ways, you might say the equipment saved his life. According to the University of Tennessee College of Medicine in Chattanooga, SIDS was recognized first in an international medical conference in 1969. Sudden infant death syndrome is defined as sudden death of an infant younger than 1 year old, which remains unexplained even after a thorough case investigation, including an autopsy. Crib death accounts for 1 out of every 5,000 infant deaths, making it the leading cause of infant mortality. The incidence of crib death tends to be higher in male babies, those born in the wintertime, and those of African American descent. Numerous risk factors associated with SIDS, as stated by the U.S. National Library of Medicine, are premature birth. Babies that are born prematurely may not be fully developed. Also, being born to a teen mother. In addition, having a short length of time in between pregnancies for a mother. A baby who's exposed to cigarette smoke while in utero and after birth also has an increased risk of SIDS. Mothers that use illegal drugs or alcohol during pregnancy cause an increased risk to the unborn baby. In addition, if there's been a death of a child in the immediate family, all babies born after that are susceptible to SIDS. Many SIDS victims experience recent respiratory illness or develop a respiratory illness right before their death. This was the case with my son's situation. He developed a respiratory illness. Thankfully, we had a monitor and medical intervention to help in that situation. That saved his life. Research performed at Mayo Foundation for the Medical Education and Research revealed several physical and environmental factors associated with crib death. One physical factor is brain abnormalities. In these infants, areas of the brain which controls respiratory, breathing, and arousal from sleep malfunctions and fails to send the correct signal to the respiratory system. This is more common in premature babies whose brain is not completely developed. In 1992, the American Academy of Pediatrics recommended that babies be placed on their back to sleep. The AAP also stated the importance of an infant sleeping not with a sibling or with a parent, but in their own bed without blankets, pads, or pillows around them. SIDS has declined in recent years and will continue to decline with the knowledge that's been given to the parents by the medical community. Thank you very much.
I got another question.
Yes.
Sleep apnea, we're talking about infants here, but it's also adults have sleep apnea, right?
Yes. There are many cases where adults suffer
Have they
from sleep
researched
apnea.
that? Have you read anything on that?
I don't know if there's any connection to that. I don't know. That would be interesting to find out.
Is SIDS hereditary?
Yes, SIDS is actually hereditary. I have a brother that died of SIDS. I have a cousin that died of SIDS. My son also had apnea issues and very easily could have died of SIDS. And then my niece also had the same thing. Any other questions?
I have another one. What can you do to prevent the the probability of SIDS, you know, to decrease it?
Well, if you look at the things that place your child at a higher risk, if you smoke when you're pregnant, if you use drugs or alcohol, or do that after the birth of the baby, that puts it at increased risk. Research has also shown that breastfeeding your baby decreases the risk of SIDS.
Very good.
Thank you.
That's